Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the disease of eyes in children. Eye is the integral part of the body and sometimes represents the body as well. Eye is well developed at birth and continues to grow till up to 14 years. Lacrimal gland is underdeveloped at birth, so no tears at birth. Along with the retina, dilator muscles, orbit and lacrimal glands develop by 4th month. Examination. Visual acuity. It can be achieved by 3 years with Snellen's charts and E-charts. Colorblindness can be tested by colored wool. Subnormal dark adaptation occurs in vitamin A deficiency, retinitis pigmentosa and optic atrophy. External examination of the eye. Eyelids for ulcers, eyeball for proptosis, growth and inflammation. Ophthalmoscopic examination in infants done by dilating the pupil with 2% homotropin or 2.5% phenylephrine. Refraction and visual fields. Eyelids. Ptosis. It could be congenital or acquired, unilateral or bilateral. Congenital ptosis usually associated with squint Turner syndrome, Marcus gun or jaw wrinkling syndrome. Sympathetic ptosis, Horner syndrome. Slight drooping is present. Neurogenic ptosis due to involvement of third nerve when congenital associated with defects of rectus muscle. Mechanical ptosis due to traumatic scarring of the eyelid. Congenital disorders, cataract due to precipitate of lens protein. Congenital usually bilateral. Lamellar cataract is usually seen in children. Acquired cataract is due to trauma. It also may be secondary to the maternal rubella, Marfan syndrome, Down syndrome or galactosemia. Rubella syndrome have cataract and or glaucoma, deafness, congenital heart disease, physical and mental retardation and hematological abnormalities. In case of bilateral or serious handicap, surgical extraction is indicated early by 6 months. Nystagmus. Congenital nystagmus, regular jerking and oscillating movements of eye in all directions are seen. Congenital nystagmus is rare, not associated with other neurological disorders. Ocular pendular nystagmus associated with the cataract or albinism, equal to and to and fro movements of eyeball are seen. Neurogenic nystagmus, rhythmic, jerky with fast and slow component. In vestibular lesion, vestibular and ear deafness may accompany. Cerebellar lesion causes abscess of tumor and brainstem lesions, and nystagmus is unilateral. Direction of nystagmus indicates the clinical region like vertical and rotatory movement results from brainstem disorder. Strabismus or squint. Congenital strabismus. It is slight and may be corrected spontaneously. by 6 months. Paralytic type. It is associated with the CNS disorders. Treatment. Surgery performed between the ages of 9 months and 2 years is likely to give good results. Delayed surgery may not reverse the acuity of vision. Eye exercises and other new techniques. Pleoptics. Stimulating macular vision are helpful in establishing the binocular vision. Pleoptics. Infantile dacrocystitis. Congenital obstruction of nasal end of nasolacrimal duct. Infection may develop managed by applying downward and backward pressure or probing after installation of antibiotic drops. Traumatic lesions due to explosion of crackers, ticks, spiders, pecks from birds and snakes, and watching solar eclipse, etc. Infection and scarring of cornea may be resulted. Inflammatory condition, blepharitis, common effect of the margin of lid causing redness, itching and crusting, caused by staphylococci. Treatment. Sulfonamide or antibiotic ointment is rubbed after removing the crusts. Conjunctivitis. It is most common types of ophthalmia neonatorum. Bacterial conjunctivitis, allergic conjunctivitis, plectanular conjunctivitis, tuberculosis, viral conjunctivitis. Treatment. It depends upon the treatment of the cause. Trachea. Low-grade conjunctivitis, keratitis, cornea is vascularized and become opaque, caused by Koch-Weeks bacillus, classified into 4 stages. Treatment. 1% gentamicin eye drops orally. Sulfonamides are given 4 to 6 weeks. Surgical correction of lids, corneal ulcers. It is an ophthalmological emergency caused by pneumococci, hemolytic streptococci, Pseudomonas aerogenes, viruses and fungi. Treatment. Subconjunctival antibiotics and systemic antibiotics. Keratomalacia, most serious form of the nutritional disorder. The cornea is diffusely hazy and dry, common in children between the ages of 1 to 3 years. Treatment. Large doses of vitamin A, 1 lakh units parenteral and followed by 1 lakh units orally the next day. Keratitis, common between the ages of 4 to 15 years due to acute immune reaction in cornea due to congenital syphilis or tuberculosis. One eye is affected first and then followed by second long after. Treatment. 1% hydrocortisone eye drops 4 to 6 times a day, 1% atropine drops. Retinoblastoma, rare but most malignant intraocular neoplasm inherited as autosomal. Dominant trait, divided into 4 stages. Refractory errors, myopia, nearsightedness. It may be of low degree or progressive myopia. It should be corrected by glasses of various types. Hyperopia or hypermetropia or farsightedness. Eye strain headache, redness of eyes may be corrected by convex lenses. Astigmatism, defect of cornea and or lens that causes rays of light to converge unequally in different meridians, causing distorted vision. Blindness of vision causes avitaminosis, trachoma, smallpox, venereal diseases, etc. Color blindness. It may be total or partial. Red-green color blindness is common, inherited as sex-linked recessive trait, detected at the age of 5 to 6 years. Cortical blindness. This is apparent from the impaired ocular fixation or wandering movements of the eye. Searching movements in infants, in older children, ignoring the objects in one or other eye and holding objects near to the eye due to defect in either half of the visual fields. Hemianopia. Cause may be injury to occipital region, cerebral tumor, pupil reactions are normal, fundus is normal. That's all about the diseases of eye in children, and in the next video I will discuss about some other disease. Thank you.